I'm Mary Kay Brooks, and I'm a director of special projects at the University of Iowa Hospitals and Clinics. Going back, 15, 16 years when I was actually a staff nurse taking care of patients, I worked in the neurosurgery area and then in the burn trauma area. And so it definitely, you definitely could see the impact of families not having that discussion when a senior member of their family was, really ill, not able to communicate. And, sometimes families would get in fights and arguments about the wishes or what should happen. And I think by having these discussions ahead of time and identifying a family member to kind of be the spokesperson and then communicating with everybody before there's a crisis would have averted some of that. And it's just such a stressful time for folks anyway to then be fighting and at odds. It's just really, hard. It was hard to see that, and you felt bad about it. And then on the opposite side, on the occasions where they did have a plan, it just was so much more, smoother, and people knew what the wishes were. The stress of trying to make those decisions for someone else wasn't there. They could just actually go through the grieving process without, going with the extra drama that could come with that. Personally, I also actually had my own advance directive made, which was a good process for me. And my mother, that's 87, also had one done. And in the process for myself, I learned that my daughter, who at the time was 19, was not ready to be my healthcare agent. So I was able to identify somebody else. And had I not gone through that process, I wouldn't have realized that